So this presentation isn't really about health per se, although you could perceive it that way, I guess, mental health or self-esteem issues. And it picks up on some of the issues that David Brennan talked about last year in terms of body image and self-esteem. So today I'll be talking about the impact of sexually explicit material on dimensions underlying gay men's physical attractiveness assessments. In graduate school taught me how to do these really long tedious titles. But what I'm really looking at is porn. I didn't want to say that when I submitted my abstract, because then it would have ended up in the spam filter, but there you go. So I'm just... Sorry. So I'm going to start off with the definition of what sexually explicit material is, at least for the purposes of this study. Talk briefly about previous studies that have tried to examine SEM. Talk about the purpose of my study, the results, the implications, and some directions for future research. So what do I mean by sexually explicit material, at least for gay men? I defined it in this study as material which shows or describes one or more males of any sexual orientation, either naked with their genitalia exposed, and or engaging in masturbation or oral, anal, vaginal sex, or some combination thereof. So traditionally, the research on sexually explicit material has taken what's considered to be sort of this harms-based approach, and basically it's sort of a lot of the research sort of decries sexually explicit material and all the harms that it has for individuals and for relationships and for society as a whole. And sometimes I wonder, when I was doing the lit review and going on to Google and just looking to see what people thought about this topic, I noticed that a lot of the documents and a lot of the reports were sponsored by sort of these family organizations like Focus on the Family and these religious organizations. And so it made me wonder that, it made me think that a lot of the research on this topic may be tainted by particular motivations. So it's kind of hard to interpret the research that that's out there. So some of the issues that have been studied include misogyny, whether porn leads to men's negative attitudes against women, rape, whether men who watch lots of porn end up raping children, internet addictions, and what I'm going to talk about today a little bit about is body image and then also attraction for gay men. There's complex literature on these issues here, and I'm not going to talk about any of them because I'm not qualified to review all of them and haven't had time yet. In terms of body image in gay men, my study wasn't about body image per se because I only had a couple of questions on that, but I will address this briefly. One study has linked sexually explicit material and body image, and Dr. Brennan cited this study in his presentation last year. And basically, these researchers found that there was a positive correlation between porn exposure and physique anxiety, which suggests sort of a social comparison effect, so that gay men are sort of comparing themselves with these idealized images that they see in porn and finding that they come up short. But the relationship in this study was quite modest. It was less than 0.3, and so nothing too impressive there. And they found no effect on two other variables that they were looking at, which is eating attitudes and drive for muscularity. Even though there was this modest relationship, it's sort of hard to determine cause and effect. Is it that men watch porn and then they become more anxious about their physique, or is it that people who are already anxious about their physique are drawn to muscle magazines and things like that because they want to get tips or see how they compare to other people? But newer studies, however, don't find much evidence for the effects of sexually explicit material on gay men's body image. Morrison, a Canadian researcher, identified a modest correlation between SEM and drive for muscularity, but there was no effect on genital or sexual self-esteem. And I do believe that the investigators, I think Joshan Dulai talked a little bit about, or quite a bit about, SEM and body image in the investigators' report. And if I recall, he didn't find any relationship between exposure to sort of sexually explicit websites and disturbances in body image. I hope he talks about that a bit more tomorrow. In terms of attractiveness, interpersonal perception, which is what I'm more interested in this project, Studies with heterosexuals also suggest that there have been contrast effects, just like there has been in one study with body image. And a lot of these studies were done in the 80s, and basically they would give men pictures of really attractive women, and then have them rate their partners or other women who were sort of in general in attractiveness, and they found that men rated average-looking women and they rated their partners as being less attractive after being experimentally manipulated with porn exposure. And they also found that the men were feeling less committed to their partners after viewing these images. But there are a few problems here, and one of them is that these are experiments that only look at sort of brief, short-term exposures, nothing really over the long term. And these experiments don't really have much ecological validity. People don't really watch porn in a laboratory the way they do when they're at home, when there are all sorts of other factors that may be moderating the effect, if any, of pornography exposure on how one perceives oneself and other people. A more recent cross-sectional study with a very large sample found that only 9% of men, again straight men, felt more critical of their partner's looks after viewing porn, and only 9% of women actually felt that their partner was more critical of them after watching porn. No research, there hasn't been much research yet on sexually explicit material in gay men's attraction, perceptions of attraction of other men. So the current study, which is based on some additional extra data I collected for my thesis, it wasn't the focus of my thesis, was to examine porn exposure and gay men's perception of other men. In particular, is exposure to sexually explicit material associated with the importance that gay men place on appearance, other men's appearance, and is SEM associated with the relative importance that gay men place on different body dimensions when judging the attractiveness of other men. And I want to emphasize the purpose wasn't to look at actual ratings of other people's attraction. It was just how important they consider certain body parts and regions when assessing attractiveness. But I will do this. I will look at ratings at another point in time if I have time. The sample was 3,600 gay men. I collected the data in 2010, recruited people mostly through Facebook over a period of 10 days. All the people completed an online survey using a website that I designed specifically for this study. It was an anonymous survey. I had a follow-up 4 to 6 months later. 1,200 people participated. Of those, 1,050 gay men comprise the current sample that I'm using for this analysis. Most of the men were from the US, followed by the UK, Canada, Australia, European Union, South Africa, Central and South America, and Asia. Average age was 40. Most were Caucasian, living in urban regions. Almost half were partnered. Most were quite well educated with a college education. Moderately involved in the gay community, and most of them consider themselves to be moderately attractive if we, on a scale of 1 to 10, if we consider 5 being average. My measure of exposure to sexually explicit material was a particular scale by Morrison, and I basically asked people in the last 6 months, how often did you view or read sexually explicit material in any of these forms? And then I asked them, did you view it 1 to 5 times, 6 to 10 times, in the last 6 months? And after about 36, I started increasing the interval, because the people who are watching that much porn probably can't enumerate exactly how much they're watching. I was quite surprised to see that I could have gone even bigger with this, because I had no idea how many people watched more than 180 times in 6 months. The measure of attractiveness was based on the scale that I developed from my thesis. It's a 21-item scale that asked people to rate the importance on a scale of 1 to 5, how important certain body parts are when you assess the attraction of another man. This was based on the initial sample of 3,600 gay men, and I basically used factor analysis. I had people rate actually 250 different body parts, and I did factor analysis to see if there were any patterns in that data, and to reduce the 250 items to about 21 items that capture each of these dimensions. The scales had good psychometric properties. People seemed to be quite honest in their responses, because there was no correlation with responses on this scale and a sort of a lie scale that I used. This is the four-factor structure of attractiveness, and on the left are the items that correspond most strongly with each of those factors. And if anybody was curious, the first three factors seem to be the most important contributors, if you will, to physical attractiveness, particularly what I call static physical attractiveness. I wasn't looking at dynamic things like expressive style and clothing and things that are changeable. Intimate regions seem to be a little less important, interestingly. So my analysis, basically, I looked at the correlation between different types of SEM and attractiveness, full attractiveness scores and the scores on each subscale. And I used Spearman's row because I had these ordinal categories with unusual distances between them. Set my alpha at 5. I'm just briefly going to show you what people have been consuming by way of exposure to sexually explicit material on TV, so naked people or people having sex. Not very much exposure to that. A little more exposure to DVDs and videos that people buy and rent. Magazines and pictures, not as much, and I think probably because, I mean, here I'm talking about porno magazines, and I don't think people waste their money on that anymore when they can get it free. Stories and magazines, same thing, not very much. Sexually explicit books, not really, which is not surprising because men don't typically read sort of romance novels, and that's basically what this was touching on. This is more of a female thing. But when we look at pictures on the internet, there was this unusual bimodal relationship with a lot of people not watching it at all, and a lot of people watching quite a bit, like almost 15% accessing this stuff practically every day for the last 6 months. Sexually explicit material on the internet, again, you know, you're getting the skew in the other direction, and again, 20% of people watching this stuff almost every day. Not very much for stories on the internet. So I just looked at a few correlations between SEM and the background demographics. The only thing that was significant and meaningful was a slight negative relationship between SEM exposure and age, so that older men indicated that they were consuming the material a little less. It's a very small correlation. There were no geographic differences, so people in all the regions were basically consuming pornography to the same extent. And again, no social desirability bias here. There was no significant relationship between SEM and the total attractiveness score, so now I'm looking at my main results. There were some expected relationships between SEM and the 4 different dimensions of attractiveness, but the correlations were all quite small, and I technically shouldn't even bother reporting them, but if anyone's interested. Viewing explicit internet photos was associated with the overall importance of all regions. Viewing magazine photos was positively correlated with the importance of muscularity, which echoes some previous studies, and all types of explicit material were positively associated with the importance placed on genitals and the buttocks. In terms of body image, not my main study interest here, but there was no, of the 2 items that I had assessing self-rated physical and sexual attractiveness, there was no relation between those 2 scores and exposure to sexually explicit material. And so I'm getting this quite fast. So what does all of this mean, and who cares? Well, basically, it doesn't appear, so I'm being a bit contrarian today, it does not appear that sexually explicit material is associated with the way in which gay men perceive other men. And there appears to be no link between the importance of body regions overall or to any specific regions. And this is in line with other studies showing little or no effect of SEM on interpersonal perception and body image. Okay, I'm talking just to mention a little bit about body image again. Like I said, I'm not too confident in these results because I only used two questions. However, there has been some research that shows that the things that we find important in other people are the things that we also tend to find important in ourselves. So if sexually explicit material is not affecting how we perceive other people, it might follow that it's probably unlikely to have a huge effect on how we perceive ourselves or the things that we consider important, the regions we consider important when judging our own attractiveness. So what might explain this weak or non-existent link in this study and the other studies? Some people might argue that given all this minority stress that gay men experience over a lifetime, perhaps this is like one part of their lives that they want to have a little bit of control over, and so they try really hard to resist evaluating themselves and others based on sort of external factors. In other words, perhaps they're more mindful of the influence of pornography on self and other attractiveness. Or, and this is my opinion, where I fall, maybe porn isn't really all that bad. Morrison did a focus group to sort of ask people about what their opinions about porn and what they get out of it. And it seemed a lot of people basically used it as sort of a utilitarian kind of thing, a masturbatory aid, if you will. Sort of, and I think you talked a little bit about, I don't know if you were you were encouraging your client to use porn. I'd like that assignment. So a few limitations to this study. As I mentioned earlier, I used these ordinal scales. I would have preferred an interval measure because then I could have done some better analyses. I didn't consider the average duration of porn watching in every particular sitting. So I only asked for frequency. I do have this data, but it's in an ordinal scale again. And I want it, ideally, I would like to multiply the number of times you watch it by average time that you're watching it, because that might give me maybe some better data. But I couldn't do that in this analysis. But I'm more concerned really about frequency because it's the frequency of exposure. If porn is bad and you're constantly being exposed to it, you would think that frequency is important regardless of how much time you actually spend. Because, again, there's experimental studies show that even a couple minutes exposure can lead to negative impact. One thing I didn't look at was dating sites and Manhunt and Grindr. I just forgot to put that in, but I think people used one of the other categories for that. I think they used internet, photo images, or whatever for that. But next time I'd like to look at that specifically. A few strengths of this study. I used a very large sample, which meant I was quite well powered, and that's why I got a whole bunch of significant relationships, even though they weren't really meaningful. My sample was pretty diverse in terms of age, socioeconomic status, education, where they lived, relationship status. I had priests, plumbers, electricians, doctors. I had an astronaut, florists, drag queens. I had like just everything. And I think Facebook recruitment was an asset in this study, and I think it's a really good way to recruit people because even though you don't get necessarily a representative sample, I think you get a more representative sample than you do when you survey just clinical populations like people who are in eating disorders clinics, because they may have a different relationship with sexually explicit material than the average person. But Facebook, given that it now attracts a very, very wide audience, including older men, and quite a large part of my sample was over 50, I think Facebook is just a really good way to get access to people who you might not normally get access to, including people who live in rural regions. The survey was anonymous, no social desirability bias, and I examined multiple types of sexually explicit material, and I used what I think is a valid and reliable measure of attractiveness perception, which is that 4-factor scale that I showed you. Future research, I might want to look at men in other countries, other ethnicities, other bisexual men, sexual minority women, make some improvements to the SEM scale, bring in some other scales like scales that specifically look at drive for muscularity, and basically examine, this is the most important thing, examine whether exposure to sexually explicit material predicts actual ratings of other people's attractiveness, and perhaps ratings of themselves based on this 21-item scale that I use. And I will do this next because I have all the contact data for my participants. So it wasn't totally anonymous because they did give me email addresses, so I can follow up. But I think that'll be my next project, and it'll be interesting to see what the results are. I don't think that there will be any really significant or major findings based on this. And finally, I think it's important to look at the benefits, if any, of exposure to pornography. We're always talking about it being a bad thing and perhaps makes people feel guilty about spending time watching porn, but I think it can be beneficial. And some focus groups that examined porn use with both gay people and straight people found that there were some benefits. Married couples, for example, say that when they watch porn together, it spices up their sex lives and gives them ideas about new things that they can do. And in some cases, it makes people happier because they realize that their sex lives are more exciting than what they see on the internet or in magazines. So that's my contrarian view on pornography, and it stands in a little bit of contrast to what David Brennan talked about last year, but I hope it adds to the literature, and I encourage other people to explore this some more if they're interested in it. So, thank you.